As with other forms of intrapartum intervention, OVD should only be performed when the safety criteria have been met and when the benefits outweigh the risk. The guidelines ये कहते हैं advise obstetrician should achieve experience in spontaneous vaginal delivery prior to commencing training in OVD. OVD should be conducted by OBS with competency in the chosen procedure or by trainees under direct supervision of an experienced trainer. With these conditions adhered to, the outcome OVD are good. In the UK, between 10 to 15% of deliveries are assisted with forceps or ventouse. The rate in nulliparous women is as high as 30%, and the incidence of OVD varies widely both within and between the countries, and this impacts on rate and of second stage cesarean section. Different strategies have been employed to help lower OVD, including provision of one-to-one midwifery care in labor and the presence of birth partner. बर्थ पार्टनर होता है कि किसी मतलब लेडी किसी को चाहती होगी ना अपने पास रखना, उस समय मदर हो, कोई भी हो, हस्बैंड हो. Delayed pushing in the second stage of labor is also very important reason of this, and especially with the use of oxygen to enhance pulsive contraction in the second stage labor, repointing the effect of the gravity, and ये सब वही चीज़ आप पढ़ लेना इसको. The history of forceps delivery is fascinating. Although the use of birth instrument was initially limited to the extraction of the dead fetus via destructive techniques from as early as 15 weeks, there exist reports of successful delivery of live infants in obstructed labor. In the 16th and the 17th century, the male midwife appeared as a new health practitioner and frequently dealt with obstructed labor. The development of modern obs forceps by the Chamberlains, a Hugland family protesting in England, dramatically changed the role of assisted delivery in favor of a live infant. The Chamberlains kept their secret for more than a century. However, it is thought that Peter Chamberlain the elder was the pioneer in the development of forceps. Hugh Chamberlain, his son, unsuccessfully tried to persuade the great French obs Francois Marconiu to adopt obs forceps. Chamberlain's visit to Paris failed miserably when Morcans mischievously challenged him to deliver a baby in obstructed labor due to contracted pelvis with maternal rickets. Chamberlain's futile efforts had disastrous effect for the mother and baby. Nonetheless, instrument delivery became more widely accepted, at least in part due to the work of William Smiley, a Scottish doctor working in the poorer parts of the London. Smiley was a great teacher of both midwives and physicians. He described the use of forceps in his treatise and the theory. ये सब वही थ्योरी बेकार की बात है, कुछ कोई काम की बात नहीं है. काम की बात बस ये वाला पैरा था. अब इंडिकेशंस की बात करते हैं. Indications of OVD can be divided into fetal or maternal. Although in many cases factors coexist, the most common fetal factor is suspected fetal compromise, usually based on CTG. The most common maternal factor is prolonged active second stage of labor. The